Hi and welcome to Omni Edition Garden City. I am Dan York and with me is Janice Norwood. She is one of the Marketplace Navigators at the Maplewood Community Center, and welcome to our program.
That is correct. Thank you so much. It's good to be here.
Explain to folks how you got to be into this program and a little bit about your background before we start talking about the Marketplace Navigator program.
Okay, sure, absolutely. Well, I kind of stumbled upon coming into this program. I'm very familiar with the community center over at Garden City. Was coming there just off and on, using some of their facilities over there with the exercising and things like
All
that.
right.
And so that's how I came upon this particular program. And liked it, enjoyed what I was seeing there in terms of the cause and what they were doing, and so I got on board with it.
Very good. All right. And for anyone that isn't totally clear, and we've had folks here to talk about this in the past, but the Marketplace Navigators at the Maplewood Community Center work with the health insurance marketplace, healthcare.gov, right?
That is correct. We are partnered with healthcare.gov.
Okay. And if there's anybody left in the world that doesn't understand that, I guess some people call it Obamacare, but explain what the program is that you people are promoting and that you're trying to get the word out about.
Absolutely. What we are doing is helping people to understand that there is help out here for them in terms of them enrolling and signing up for health care coverage.
Okay.
So we're actually navigating them through that process.
That's the term.
Yes, that's the term. And we're answering questions, and we're basically just guiding them from enrollment through care.
Okay.
Following up with them in between, and just being that guide for them.
Okay. Now, recently, the big push was a deadline that we have now passed.
Correct.
Where basically under the law, every person in America was supposed to have insurance, health
That's
insurance,
right.
except with limited exceptions, either through their employer, through purchasing insurance themselves, or through the government marketplace.
Correct. Correct.
And now that we've passed that deadline, I'm sure obviously there wasn't 100% compliance. Now, folks that did not comply should expect some sort of penalty, for lack of a better term,
Absolutely.
when they do their taxes next, right?
Absolutely. If you do not comply, there is a fee, and it's $695.
Wow.
And so, yes, absolutely. If you are not signed up, you have to pay the consequences.
Okay. And the concept here is that through the healthcare marketplace, you should be able to find insurance that fits not only your needs age-wise and health-wise,
Yes.
but financially.
Yes, absolutely. There are many plans, choices, options. You are definitely, there's the big focus on finding something that fits your particular circumstance. So it's not a cookie cutter type situation. And there are things that will do just that and will help you to get there. There's also assistance for you if you qualify to pay for your health care. So there's lots of things to help you to get where you need to go in terms of your health care.
So Garden City has been fortunate in that Monica Fulton and the people at Maplewood Community Center were able to secure a grant from the federal government to set up this Navigator program at the Maplewood Community Center. Now,
Yes.
it's not just for Garden City, right? It's for multiple communities around
That's
us?
correct. That's correct. Anybody who can see this program, anyone who needs this service, can utilize it.
Okay.
The Metro Detroit area and surrounding areas, all of Wayne County. So there's a large reach.
Okay. And they come to the community center. This is not an online thing or
Yes.
submitting forms. You want people in the building where you can physically talk to them
That's
and
correct.
find out what they need.
That's correct, yes.
Okay. So since we're past that deadline where people should have been enrolled, I guess the two questions are, if I got this far and have no health insurance and now I'm having buyer's remorse that I should probably take care of that, is
Yes.
it too late? Is the sign-up period passed? How does it work?
The sign-up period has passed. However, there are various life circumstances, life changes that would qualify a person for a special enrollment period.
Okay.
And some of those things could be having a child or getting married, change of jobs, change with your financial situation. So those situations would qualify you for a special enrollment period.
Okay.
If you miss that deadline, however, and you don't have any of those special circumstances, you'll have to wait until
Okay.
the next enrollment period.
And that would be towards the end of the year, I assume,
That's
for
correct.
2017.
That's correct. And
Okay.
it does kind of fluctuate,
Mm-hmm.
but for 2016, the enrollment date, it ended January 31st.
Okay. So the assumption can be, without knowing exactly, that for 2017, the enrollment deadline would probably be similar towards the
Yes.
end of January of 2017.
Yes, I would say so,
Right.
yes.
And do we know when it opens, or is that not yet been
It
determined?
opens, well, for 2016, it opened November, I believe it was November 1st.
So probably in the same
in
area.
the same bracket.
Okay. So not only is there a component that involves the individual, but the healthcare marketplace also, there's something there for small businesses, correct?
That's
So you don't
correct.
have to be Ford Motor Company or the City of Garden City that
That's
has
correct.
a large group plan. You can actually put together a plan for a small business through the
Yes.
marketplace?
Yes, as long as you have at least from 1 to 50 employees
Okay.
who are working 30 hours a week, that's considered full-time,
Okay.
then we can assist that employer with setting up those folks for enrollment.
Okay. So they would come into the marketplace just like an individual would?
Absolutely, yes.
Okay. So if someone wants to come in to the marketplace, well, let me back up and ask you this question real quick. So if I'm an employer, what's my motivation, I guess, to do that? Are there tax
Yes.
credits for the
There
employer?
are tax credits. You can also receive up to 50%. You can get up to 50% of your contributions to premiums. So you can pretty much determine what you want to pay
Okay.
into those premiums and contributions.
Okay.
So the tax credits is a great incentive.
So it's a flexible program.
Yes.
All right. So if someone wants to come into Garden City, the Maplewood Community Center, or to any of the other, looking at my list here quickly, it looks like Dearborn Heights, Westland, I'm not sure where Westland Jefferson is. Is that?
Yes, yes, Westland Jefferson Barnes.
Okay, and then Dearborn Heights City Hall. What's the phone number in Garden City, and should they call before they show up, or can they
Yes.
just show up?
The phone number is 734-793-1849.
Okay.
And they do need to make an appointment before they
Okay.
come in. So just give us a call and we'll schedule an appointment and we'll sit down with them and work things out.
So even if we didn't make it clear here today, they can come in
Yes,
and
they can.
and they can have it made clear at the Maplewood Community Center or the other places in the area.
Yes, that is correct.
Okay.
Yes.
Well, I want to thank you for taking the time to stop in and talk with us,
Thank you for having me.
and wish you the best of luck with the program there at Maplewood Community Center, and wish you the best of luck with your new job with the
Thank
Navigator
you.
program.
Thank you so much. Nice
All right.
meeting
Thanks
you.
very much.
Thanks for having
All
me.
right. That's Omni Edition Garden City for this week. Thanks very much for watching, and good night, everybody.